And meantime, health care officials say the Senate-passed spending bill could threaten health care funding in Virginia.
Opponents say if the Senate bill passes as is in the House, it could lead to major cuts to Medicaid and hospital budgets, putting coverage at risk for hundreds of thousands of Virginians. Shane Fordham has details. Shane.
Well, Virginia hospital leaders say the Senate-approved spending bill could put hospitals and Medicaid for Virginians in jeopardy, especially those in underserved and rural areas.
Given the two choices between the House and the Senate plan, the House plan is much preferable to the Senate plan because the Senate plan would just be financially devastating.
The House version of the Republican spending bill, which recently passed, preserves Medicaid access in Virginia, while experts say the Senate-approved version could drastically impact funding. Political expert at Virginia Wesleyan University, Leslie Coggle, says the ends do not justify the means.
Why would we deal with all of these kind of negative ramifications? For many politicians, I think it's not yet clear, aside from the fact that President Trump really wants this victory.
Julian Walker with the Virginia Hospital and Healthcare Association, or VHHA, estimates the Senate-approved spending bill would cost Virginia hospitals more than $2 billion annually in essential funding.
This is something that is of concern beyond the four walls of the hospital. It should be of concern to anybody who lives in a community, who needs access to care, who wants to have a good quality hospital nearby.
Now, the House is meeting today to review the bill passed by the Senate, aiming to approve the final version by July 4th so it can go to the president for final signature. Shane Fordham, 13 News Now.
All right, thanks so much, Shane. So in her statement at 13 News Now, Congresswoman Abigail Spanberger says this bill would threaten the survival of our rural hospitals and overwhelm our emergency rooms. And Lieutenant Governor Winsome Earl-Sears also commented, saying, "Let's wait and see what happens before a final bill is signed." She said Virginia has more than $1 billion in surplus and will make sure everyone gets the insurance they need.